So hello everyone, I am Hannah Christal Bacus, a student nurse of Davao Doctors College from BSN1 11H, and today I'll be assessing the anterior and posterior thorax. So the traditional systemic approach involves inspection to be followed by palpation, percussion, and auscultation of both anterior and posterior thorax. So this assessment will help us to determine if the patient has any abnormalities. So the first thing we do is to review the client, if necessary or if available, to review the client's medical record and determine the scope of the assessment if needed. So this is done to the extent of the patient's physical examination. So you have to prepare the necessary equipment that will be needing during the assessment, such as the stethoscope, a marker, a measuring tape, sterile gloves, and also a comprehensive assessment. So before anything else, before we start the assessment, we need to perform first hand washing or hand hygiene to deter the spread of microorganisms. So before doing the assessment, you need to greet the client politely. So introduce yourself and verify the client's identity. And then ask how the client would like to be called during the assessment. So it is done to establish rapport with the patient. So next is to explain the procedure to the client and how he or she can participate during the assessment. Next is to provide the client the opportunity to clarify or ask or raise any concern. And also, you have to ensure the client's comfort, privacy, and confidentiality. So the assessment should be assured to be safe, secured, and free from all distractions. So let the client sit comfortably. So good morning, ma'am. I am Hannah Christal Bacus, and I'll be your student nurse for today. So first, ma'am, may I know your name? Shane Morales Incamo. And when is your birthday? March 3, 2000. So, ma'am, so how would you like me to call you? Okay, so today, Shane, I am going to assess your thorax. So the procedure that I will be doing is that I am going to touch and expose some parts of your body. Then there are movements or procedure that you should follow. Is that okay?
Yes.
Okay, so do you have any questions or clarifications?
Nothing.
Okay, ma'am. So first, before doing the assessment, I am going to ask you some questions, and you have to answer them honestly. Is that okay?
Yes.
Okay. So I'll start na po sa questions. So do you ever feel chest pain? Any chest pain po?
No.
No. Do you observe breathing when you breathe? No. So do you have any problems when you breathe, when you're in breathing?
No.
So you don't have, you don't encounter any problems in breathing at all?
No.
Okay. So ma'am, these notes that I am taking, I am taking is rest assured that this is completely confidential. So this is between me and your attending physician. ma'am, I'll be now proceeding to the assessment. So do you have any more questions or clarifications?
Nothing.
Next, I have ensured the patient's privacy and confidentiality by closing the doors and also closing the curtains. So next, I have provided adequate lighting and adjust room temperature for patient's comfort. Okay, in starting the assessment, we need to check for any respiratory distress or problems with oxygenation. So we have to observe the color of the face, the lips, the chest, and the fingernails of the patient. Then, you have to palpate the suprasternal notch and note the position of the trachea. So, Shane, can you please inhale and exhale for me? So now I am going to observe the color of your face, so your lips, your chest, and your fingernails. Now Shane, can you please turn your head to the left side? Left ni mo.
Dire.
Dali ay mo left.
Dire. Tapos, dire lang.
Dali ka lang. Now to the right side, please. Okay, thank you so much. Now, in examining the posterior thorax, so first you have to inspect for the configuration while the client stands with arms at the sides. Then you have to stood behind the client and observe the position of the scapulae and the shape and the configuration of the chest wall. So, Shane, is it okay for me to touch your chest?
Yes.
Okay, now can you please turn around for me? Okay, thank you. So next is to check the spinal alignment for deformities. So from a lateral position, we have to observe the three normal curvatures, which are the cervical, the thoracic, and the lumbar. So can you please turn around, Shane? So now I am going to assess for lateral deviation of spine or scoliosis. So you have to observe the standing client from the rear. So have the client bend forward to the waist and observe from behind. So Shane, can you please bend forward just like you are tying your shoelace? Okay, thank you so much. Okay, kanya kang balik. So next is to palpate the posterior thorax. So you have to assess the temperature and integrity of all chest skin. So palpate all thorax areas for bulges, tenderness, or abnormal movements. So Shane, I am going to touch your chest wall or posterior thorax. Is that okay?
Okay.
So next is to palpate the posterior thorax for respiration excursion or the thoracic expansion. So you have to place the palms of both your hands in the lower thorax and with your thumbs adjacent to the spine and your fingers stretched laterally. So you have to ask the client to take a deep breath while you observe the movement of your hands and any lag in movement. So Shane, can you please take a deep breath? Okay, another one. Okay, again. So next is to palpate the thorax for vocal or tactile fremitus. So the faintly perceptible vibration felt through the chest wall when the client speaks. So you have to place the palmar surfaces of your fingertips of the ulnar and a speck of your hand or closed fist on the posterior thorax. So starting near the apex of the lungs. So you have to ask the client to repeat such words as blue moon or 1, 2, 3. Then repeat the 2 steps. Then moving your hands sequentially to the base of the lungs. Then you have to start toward the midline of the level of the left scapula, so that is over the apex of the left lung, and then move your hand left to right, comparing findings bilaterally. Move symmetrically downward and out to cover the lateral portions of the lungs at the bases. So you have to compare the fremitus on both lungs and between the apex and the base of each lungs. So Shane, say the word blue moon as I palpate your posterior thorax, okay?
Okay. Blue moon. 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 Blue moon.
Next is percuss the posterior thorax. So ask the client to bend the head and fold the arms forward across the chest. So percuss in the intercostal spaces at about 5 cm interval in a systematic sequence. Then compare one side of the lungs with the other. Then percuss the lateral thorax every few inches. Then starting at the axilla and working down the 8th rib. So now, Shane, I am going to percuss. Now I am going to percuss your posterior thorax. Is it okay?
Okay.
Next is to measure the diaphragmatic excursion. So use percussion to identify the level of the diaphragm and measure diaphragm excursion. So percuss downwards from above the expected level of diaphragm dullness until dullness is definitely heard. So mark the level of full expiration. So after gaining the patient's permission for the marking, have the patient inhale deeply and hold it in. Then percuss downward to the level of dullness and full inspiration and mark it. Then repeat the process on the other side. Then measure the distance between the expiratory and inspiratory levels of dullness. Now, Shane, I am going to proceed do the measurement. I am going to mark your back. Is it okay?
Okay.
So can you please inhale and hold it. Inhale, then hold it for me, okay?
Okay.
Inhale, please. Okay, can you please inhale, then exhale, then hold it again, okay? Um, Now to the other part. Can you please hold it? Inhale. Okay. Exhale. Now can you inhale and exhale, then hold it for me again, please. So next is to auscultate for breath sounds. So place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lungs at C7. So ask the client to breathe deeply through the mouth for each area of auscultation. So using the systematic ladder pattern used in percussion, so listen at each point of the breath sound during a complete inspiration and expiration. So you have to compare the findings at each point with the corresponding point on the opposite side of the thorax. So note the location of the chest wall where adventitious sounds are heard, as well as the location of such sounds within the respiratory cycle. Okay, now Shane, can you please inhale and exhale as I say? Now is to auscultate voice sounds bronchopony. So ask the client to repeat the phrase 99 while auscultating the chest wall. Then egophony. So ask the client to repeat the letter E while listening over the chest wall. Then whispered pectoriloquy. ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. Okay, now Shane, can you please say 99 as I check for your chest wall?
Okay.
Okay,
99, 99, 99, 99, 99, 99, 99, 99.
Okay, now I want you to say E, the letter E, okay? Okay, now I need you to whisper 1, 2, 3, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
So, okay, next is assessing the anterior thorax. I have to inspect breathing patterns, inspect the costal angle, and the angle at which the ribs enters the spine. So, Shane, may I have your permission to touch your breast? Is it okay?
Okay.
So, can you please inhale and exhale for me?
Okay.
One more time. So next, palpate the anterior thorax using your fingers to palpate for tenderness and sensation. So start palpating with your hand, position over the left clavicle, and move your hand left to right. So comparing findings bilaterally. So move your hand systematically downward toward the midline at the level of the breast and outward at the base to include the lateral aspect of the lung. Then repeat the sequence in palpating for crepitus and firmitus in the anterior. So Shane, I am going to touch your chest again. Is it okay?
Okay.
Next is to palpate the anterior thorax for respiration excursion. So you have to place the palms of both your hands on the lower thorax. So with your fingers laterally along the lower rib, and your thumbs along the costal margins, and then ask the patient to take a deep breath while you observe the movement of your hands. So can you take deep breaths? Okay, again. Next is percussing above the clavicles in the supraclavicular space and proceed downward to the diaphragm. So compare the lung on one side of the lung and the other side. So this you have to displace female breast to facilitate percussion on the lungs. So Shane, can you please lie down? Are we now starting to percuss your lungs? Okay, for the last part of the procedure, auscultate for anterior breath sounds, so adventitious breath sounds, and voice sounds. Then auscultate the trachea, auscultate the anterior thorax. Now you have to place the diaphragm of your stethoscope firmly and directly on the anterior chest wall. Then auscultate from the apices of the lungs, slightly above the clavicles, to the bases of the lungs at the sixth. Then ask the client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with nasal breathing. Then you have to listen to each side for at least one complete respiratory cycle. Then listen for normal breath sounds and adventitious breath sounds. Then follow the systematic ladder pattern. So Shane, can you please sit properly, please? So now I want you to take deep breaths, okay? Deep breaths using your mouth. So now I am done with the assessment. So I am going to summarize the information obtained during the working phase and discuss the findings to the client or the patient. So discuss to the patient possible plans to resolve health concerns if present. So assess for client's understanding of the plan and the need for furthering teaching. So you have to provide the client the opportunity to clarify, ask or raise any concern. So okay, Shane, I'll be summing up everything that we have covered. So so far, I didn't see any problems with your posterior and anterior thorax. So your spine is vertically aligned. And your spine is vertically aligned and straight. No scoliosis found. So while palpating your anterior and posterior thorax, your skin is intact and temperature is normal. There are no tenderness or masses. As I was listening to your breath, sounds. It was also normal, and your breathing pattern your breathing pattern is quite rhythmic and effortless respirations. So basically, everything that we have covered for today are all normal. So there are no I have nothing. There are no abnormalities found. So that is all. So do you have any questions or clarifications or any concerns?
Nothing.
So nothing. So okay, thank you so much, Shane. So thank you so much for your cooperation. So that is all in assessing thorax. So after the assessment, do not forget to perform hand hygiene.